welcome everyone to the Jackson Listening Tour. We are going to hear some amazing information today. I have to thank everyone for participating, and especially these wonderful healthcare providers who are making a difference every single day in the lives of so many here in Mississippi. We're going to begin with Dr. Damon Haynes, and he's going to welcome everyone and give you some information about how important this listening tour is and what it means for the Jackson community.
Thank you very much, Maggie. So first, I want to thank you all for being here today. As Maggie said, I'm Damon Haynes. I'm a pulmonologist, so a lung doctor. For those of the non-medical folks on the phone, that's what we're commonly referred to. I want to welcome all of you here to kick off this Chest Foundation's National Listening Tour. We are extremely excited and honored that Jackson is able to be a part of this national search for a solution for healthcare access and equity for patients with lung disease. We started this process because we know that not everyone has equal access to healthcare. Not everyone with lung disease can access a pulmonologist like myself and several others on the call here that you'll hear from. And we also know that not everyone can afford appropriate treatment, whether it be inhalers or oxygen or nebulizer therapies or many other things that some of you are familiar with on here. This work is extremely important to me as a native Mississippian and a resident of Jackson for the past 25 years. I have a passion for providing care to patients with lung disease and also helping train future physicians for the state of Mississippi. Today, all we want to do is listen and learn. We have physicians and doctors on the phone. We have some other healthcare clinicians and other healthcare experts. We have some patients and some caregivers that are here with us today. We have community leaders that we're so grateful for that have joined us and are giving of their time. And we have some national leaders from the Chest Foundation who started this conversation for us, and they can help us enact change. We're extremely grateful for the part that you all will play in this listening tour. So now it gives me great pleasure to hand this back over to Ms. Maggie Wade from WLBT, who is our moderator for the conversation today. Maggie, back to you.
Thank you so much, Dr. Haynes. I appreciate you. I am really honored to be here with all of you. These issues are very important to me. Like so many in Mississippi and throughout the nation, I've had family members who have had issues with lung disease. I lost an uncle to lung disease, and watching him struggle to take every single breath in the last stages was heartbreaking. And it makes you want to become more of an advocate. And that's why I'm truly honored that I was asked to participate today, as well as a dear friend who had lung cancer. Many of you may remember Stephanie Bell-Flint and her battle with lung cancer. And a lot of the doctors here talked with her, a lot of the doctors we have today. So lung disease is a very important issue and very near and dear to my heart, as well as my family's. Let's start with the introductions now. You've already heard from Dr. Damon Haynes. He's the Associate Dean for Admissions, the School of Medicine, and Professor of Medicine, Division of Pulmonary and Critical Care at the University of Mississippi Medical Center. And we're not all together, but we can give him a round of applause. How about that? I just added that in, Dr. Haynes. I'm gonna do that for everyone. Also, Dr. John Studdard. I am so grateful that I got a chance to talk with Dr. Studdard. He's a pulmonologist with Jackson Pulmonary Associates and past president of the Chest Foundation, and just a wonderful and true blessing for Jackson and the state of Mississippi. Let's give him a big round of applause. Dr. Studdard, thank you for all that you do. Also, Bobby Morgan is a governmental affairs and public policy expert and currently works for Atmos Energy. Thank you so much for being with us. We're sending you virtual claps too. Thank you. Dr. Justin Turner, another dear friend. He's an internal medicine doctor, and he operates his own clinic in Jackson, Mississippi. Very active in this community, is all about health, getting people moving, getting people healthy, and doing whatever he can. So let's give him a big round of applause. Thank you, Dr. Turner. Also, Rudy Anderson. He's the executive director of the Chest Foundation. He has spearheaded this listening tour to shed light on issues of trust, of access and equity that exist for patients with chronic lung disease. Let's give Rudy a big round of applause. I'm loving getting to know you, Rudy. Thank you for all of your work. At this moment, I'd also like to recognize some Jackson dignitaries that have joined us today. And of course, they include the wonderful mayor of the city of Jackson, our own, the Honorable Mayor Chokwe Antar Lumumba, as well as our wonderful Lieutenant Governor Delbert Hoseman and Senator John Horn, another person who is so active in our community and working to make a difference every single day. Let's give all of them a big round of applause. Thank you so much for being with us. Well, at this time, the Chess Foundation, we'd like to learn more about that. And so they're the host for this conversation. And Rudy, as I've said, is the executive director. He's going to explain just a little bit about how this afternoon came to be and what the foundation's vision is for this listening tour here in the Jackson, Mississippi area. Rudy.
Oh, thank you so much, Maggie. Really appreciate that wonderful introduction. And it has been an absolute honor and blessing to get to know you two over the last couple of weeks. So, you know, for many of you, I'm sure, right, you don't necessarily know who the Chess Foundation is or even our larger organization, the American College of Chess Physicians. But many of you may know the lung doctor that could help you, have helped a loved one, has helped someone in a critical care unit. And lucky for us, we're the representatives of those doctors, and we're so blessed to work with them. And with that, the Chess Foundation really has always been focused on how we can champion lung health and how we can support patients, right? What do we do to help deliver greater access? How do we empower the conversation between patients and caregivers? And how do we support the communities in need? And you know, to give you a story really that emulates why we do what we do, you know, I just wanted to share something about one of our programs, which is the Erin Popovich Endowment. So I'm sure many of you have heard that last name, Popovich, but what you don't know is Erin Popovich was the late wife of the great coach, Greg Popovich of the San Antonio Spurs. Unfortunately, just 2 years ago, she had passed away from lung disease that she had struggled with for a very long time. And her most trusting clinician, you know, was lucky enough to also be listening in on this call, but is a phenomenal lung specialist in San Antonio. And working with her, one of the things they had realized was they had done so much, right, to get her better and to get her comfortable with what she could do as a patient. But what they realized was even with all the resources that they had, it was still a struggle. And so part of that was, how could others that might not have the same resources that they do also struggle with that? And we've been lucky enough to work with them to think through what can we do to provide that access, to provide the resources that are necessary for many people that are on this call, but many others that are struggling. And so we really wanted to use the strength and passion that the Popovich family has lucky enough to impart on us, to use that as, you know, a larger fire to shine a light on those of us that have been suffering. And so when you hear that, you know, then the question is, well, why us and why now? I'm sure many of you, and I know I'm making an assumption, the summer has been filled with tension and I don't know if tension is the right word, because I think many of us have felt that tension for a long time. And for some people, maybe the summer has started it for them. But honestly, I think what this summer has brought is, it's been a little bit of a different tension. I think it's given us an opportunity to say, here's our chance to say something, because maybe more people are actually listening to us. And so that really resonated, I think, with us having this conversation, even internally with Chess, to say, what can we do to actually make a difference in the lives of so many that are struggling, especially with chronic lung disease. What we've really thought of is chronic lung disease has been this fire that's been burning for quite a while, but not everyone's been able to see it. And unfortunately this summer, when you consider the unrest and you consider COVID-19, it's shown such a brighter light on the issue at hand. And here's a chance for us to come together, listen, and have a conversation. And so I just wanted to put together a few things that you guys can can know that we're going to take away from this, because this is just the beginning. This isn't the end. So in the coming weeks, we will release a report that shares the findings of what we've learned today, but also we plan on launching a very ambitious fund that is dedicated to ensuring that we are creating greater access and equity to the resources for many patients that deserve that support, not only in Jackson, Mississippi, but all across the country. That fund will directly support you, the patient, the caregiver, and I say you because we've all been patients at one time or another, right? And so obviously we are all very eager to learn what's going to come today, but we're obviously excited to listen, to understand how we can continue to build trust among doctors, patients, and the community overall, to seek more answers on what the resources of your community and many others need. And most importantly, how do we continue to give a voice for those that aren't screaming the loudest that maybe others have been hearing before. So with that, I just wanted to pass that baton over to Dr. Turner, who will actually talk about some of the issues that are arising in the state of Mississippi. Dr. Turner.
Operate my own internal medicine practice, and these are the patients that I see every day. So I know firsthand the barriers that they face. So even before the coronavirus epidemic, even before all of this, we've had issues with health disparities. It just so happened that COVID-19 has exposed those. So Mississippi has had one of the highest death rates in the country for lung disease and asthma for some time. The American Lung Association, most recent estimates indicate that close to 14% of people in Jackson in the area have lung disease, chronic lung disease. The US Census estimates indicate approximately 16% of people do not have health insurance, and 27% of the population lives in poverty. Despite this high rate, listen to this, we only have 26 pulmonologists here in Jackson. So we have all of these high percentages, which are not good, but we have only so little specialists that these patients can see. So there's definitely a disparity in health outcomes. Black and Latino people in the United States are 3 times more likely to contract COVID-19 compared to white neighbors, and nearly twice as likely to die. More than half of Mississippians currently diagnosed with COVID-19, and nearly 3/4 of the virus current casualties are African American, and that's according to the Mississippi State Department of Health. So the state data on disparities in lung health indicates that African Americans are less likely to have gotten a pneumonia vaccination, they're less likely to be covered by healthcare, and they're less likely to be a non-smoker, meaning that many do smoke. All of these are additional risk factors for lung disease. The last barrier is the fact that, yes, Jackson residents have faced COVID-19. We've had over 2,700 deaths and over 90,000 people who've had COVID-19. But the problem may actually get bigger. Hinds County far outranks the rest of the counties in the state by a significant margin. We also see that COVID-19 can cause lasting harm to the lungs, increasing the demand for lung health care. The pandemic has also pushed many Jackson residents further into poverty. Now, if they have less access and less resources, then some of these patients are also less likely to follow up with their specialists. They may delay office visit because they don't have insurance, they may can't afford their copay. But not only do we have a problem with people not having insurance, we also have a problem with people being underinsured. So they have insurance, but they have a deductible that's $2,500 and they have to meet it before the insurance kicks in. Or they have insurance, but their albuterol inhaler may cost $50, $60 and they have to choose between that and their bills. So all of these pieces of data feed to the same outcome. And that's a drastic disparity that we have here in healthcare. Our communities are getting better, but we need to take the time to listen and, more importantly, create action to fix it. So thank you.
Thank you so much. We're going to turn it over now to the people who see these issues every single day. First, Dr. Damon Haynes will introduce a patient and his daughter who primarily takes care of him. Dr. Haynes.
Thank you so much, Maggie. I have the privilege and the honor to be the pulmonologist for Mr. James Lindsay. He's here today. I want to introduce everyone to him. I've taken care of Mr. Lindsay for several years. His daughter, Constance Baker, is also with him today. She is his primary caregiver. Mr. Lindsay suffers from a disease called scleroderma. And from that scleroderma, he has interstitial lung disease and also pulmonary hypertension. So many people commonly talk about pulmonary hypertension as high blood pressure of the lungs, but it's a significant and debilitating disease that causes significant shortness of breath. On top of that, he has the interstitial lung disease due to his scleroderma. So Mr. Lindsay and Constance, thank you so much for joining us today.
It's our pleasure.
Constance, would you or your father like to start and just share your story, if you don't mind?
Yes, and I say 2000, and I'm the caregiver of James Lindsay, my father. My name is Constance. By 2012, he was diagnosed with, well, he wasn't diagnosed with scleroderma. He was going to the Jackson Hines Medical Mall where he found out, where it was a doctor provider, didn't know quite what it was. Then he sent and had him sent to Dr. Haynes at the pavilion. And then they ran tests and they found out what his problem was. And like I say, he has scleroderma and he has pulmonary hypertension. Since Dr. Haynes has been taking care of James Lindsay, it's been tremendous, like great. He found out what it was. He got strictly to the bottom of it. And ever since then, he's been progressing from the medicine that he has provided him.
When did you first notice that your father was having problems and that he needed to see someone?
Like I say, it started in 2005. The color of his skin started to change, and he was shortage of breath, and his hands started to contract, and that's when we noticed that he needed to see someone. But it started with the color of his skin changing.
Constance, do you mind sharing some of the hardships that you face specific to that situation? I know we talked before, you have a family and at the time, a small baby. Tell us about the hardships you have had to deal with in your family.
The hardships starting off, like I stated previously, I had just had a baby, dealing with a newborn, then me being his caregiver. It was very difficult because at the time he was bad, kind of pretty off dealing with his situation. And Dr. Haynes provided him a medicine that he had to been out for 24 hours. It was a medicine that I had to, not just no one but me had to make. Either if I didn't make it, then his life depended on it. So it's basically dealing with a newborn, then to make sure that my father is prepared to have his medicine and everything, that I had to stop to make it. If not, if it wasn't made on time or correctly, then he would die. So that was kind of a challenging time in my life, because I had, like I say, I had a newborn, then a teenager as well, then dealing with my mom as well was sick. So at that point, it was very difficult.
How did you deal with that pressure? That seems like an enormous amount of pressure to try to make sure your father stays alive in addition to everything else.
I dealt with it, to be honest, through prayer. And that what got me through. And just each day, what I did to kind of make it a little better on me, I started doing the cassettes 3 or 4 times. Like instead of just making one just for that day, I had to find a way that I could cope with, to make it easier on me due to I had so much going on. So what I tried to do is make 3 to 4 cassettes at a time. And out of making those cassettes, it took like, each one of them, it took probably, I say between 15 minutes to 20 minutes a piece, because I had to go step by step. So therefore I wouldn't mess it up. I had to change because he had it on his chest. So I had to change his dressing every day, make sure it didn't get infected. So the way I got through it, I started to making more cassettes at one time and in prayer. And we got through it. And each day got easier and easier.
Constance, can you tell us why you had to be the caregiver? Is there a particular reason that concerns your father?
It always has been my father and I. And at first I had a daughter, now I have a son. So it's always been just us two. And he's my father. So I felt like he has always taken care of me. So at this point, when he's down, he's depending on me. So that was the only thing that I could think of is his turn to be catered to.
Did your father understand what was going on, and how did you help him understand? Or can you explain to us what he didn't understand and why?
Him being him, I think the more that he didn't really understand the seriousness of it at first, until Dr. Haynes and Dr. Haynes and his team talked to him about how serious it could be and how serious it was. And he learned that it was it's a life or death situation. So it's a life or death. So once he got his medicine under control and did the things that Dr. Haynes provided him to do and asked him to do, it got easier with him. It was something that he wasn't used to, but at the time me and him had a discussion, he wanted to live. So in order to live, he had to go by the rules that Dr. Haynes provided for him.
Now, could he read and understand the directions? Because you mentioned putting that medicine together, you had to make sure that it was right and that he took it on time because it was a matter of life and death for him.
Right. He can read certain things, but he can't really read or write. But certain things he do understand. What I did, if he couldn't, he knows his medicine. He knows what to take. So, but he knew what to take, and he knew how to work the machine. He knew how to put it on. But I had to as I was taught, as they taught me and I was learning, I also taught him as well. So it's basically we taught each other. Because if I did something wrong or if I didn't clean this or clean that, he was always there saying, you didn't do this right, you didn't do that right. So as I can say, we learned together.
Awesome. Thank you so much, Candace. And Mr. Lindsay, I hope you will chime in at some point because we do want to hear from you as well, since you are the patient. But right now, we're going to move on to Dr. Justin Turner, and he will now introduce us to a patient with a story that we all can learn from. Dr. Turner.
Thank you, Maggie. Well, I have known Shalise Berciaga for a while, probably over 25 years. We grew up together in Vicksburg, Warren Central, Vikings. Woo-hoo. So I know that she has struggled with asthma pretty much most of her life. And I know that once she turned 18 and she no longer qualified for her mom's federal health insurance, it's been a little different for her as it relates to access to healthcare and actually having affordable healthcare. Now in 2020, all of this was exacerbated by the fact that she had COVID-19. So Shalise, if you don't mind, can you kind of expand on your story a little bit and maybe kind of talk to us about some of the barriers that you may have faced during your journey?
Most definitely. Thank you for the introduction. And I'm glad to be here. And as Justin stated, I did in fact I have suffered from asthma severely as a child. And as I got older, I learned how to manage it. I had awesome doctors when I was young, and that was simply because my mom had the federal insurance, which is awesome insurance. So you always get the top-notch doctors. And I had two wonderful pediatricians, but one passed away. The best one, he was willing to continue to see me while I was in college, even though I was over the age of 18. Unfortunately, he passed away. So when I did have a problem, once I went to college, I called his office. I didn't even know he had passed away, but I called his office because that was the only person I knew I could trust that could help me. And when they told me he was gone, I had nobody else to turn to. And so I just really had to take what I learned as a child to help manage my asthma as an adult. Since then, you know, I kept it pretty much under control throughout my adult life. Whenever I did have a problem, we have MEA clinics. Because as a student, you can't always go home and see your primary doctor that you used to see when you were a child. And in college, you know, you don't have a car. So I still do not have a primary care physician. I go to MEA quite often whenever I get sick. They have my records, but they really just, you know, treat the surface of everything. And I would call and ask them, can you send me a prescription for an inhaler? And that's what I would do for years. But like I said, I got it pretty much under control until recently when COVID happens. And I realized that when they say you still have symptoms or it does cause problems after the fact, you have lingering problems, and they're telling the truth. Because mine was very, very well controlled until then. I did get COVID at the end of June, beginning of July. It kind of attacked me through my sinuses, and after about 5 days, it started to move down to my chest. I did not have an inhaler. My oldest daughter has been diagnosed with asthma as well. She doesn't have an inhaler because the doctor she was seeing is no longer at the clinic, and he was an awesome doctor. But he's not there anymore. And so I had to do pretty much home remedies to help myself get better and get over COVID. Truly home remedies, and it helped. But what I have started noticing is that now I'm starting to have chest pains again. I'm starting to have those little problems that I had as a child with asthma. And like I said, from what I've learned when I was a child and all the things that I went through and how I managed it as a child, I'm starting to have to do that again as an adult, because I don't know a quality asthma doctor. And I am a teacher. I have state insurance, but my deductible is high. So whenever I go to the doctor, I don't get sick often. So I don't go to the doctor often. So whenever I go, I have to pay out of my pocket, which is pretty costly. My youngest daughter needed to be recommended to asthma allergy specialist as well. Last time I took her to the doctor in April, but due to COVID, she could not get their referral at that time. She couldn't get the referral, and they have an awesome pediatrician, but the insurance that they have is no longer accepted by that pediatrician. So I wanted her to see a quality doctor, and I had to pay out of my pocket, which was a pretty hefty bill out of my pocket unexpectedly, just to take her to the doctor. And that had to be paid. Now with the way COVID has things set up, I had to pay that bill before she could even walk through the door. And so I paid it. They said that she needs to go to the asthma allergy doctor as well, but they couldn't refer her at that time. So now through everything that I've dealt with, I pretty much manage the health of me and both of my girls at home through what I've learned and through different home remedies, because it's just expensive. When I had COVID, you know, they now sell inhalers over the counter for like $20, $25. I called a friend who uses the over the counter inhalers quite often. He sent me one. Well, I took 2 puffs off of it and it burned my chest. So that just let me know, hey, I can't use this inhaler. It's not the type of medicine that I can use. So like I said, through home remedies, and I will tell anybody, what saved me was what I call a breathing pot. And it's, you know, an old home remedy. And it really, really helped me get over COVID and not have it attack me so bad through my through my asthma.
Julius, we know that there are asthma sufferers out there who right now are scaling back on how often they use their inhaler because of the expense. When you get one, have you had to experience the same thing, or is it your prayer that you don't have to go through that with your daughter because of the cost?
Well, this is unfortunate, but you know, whenever I do, when I have gotten to the point where I had no choice but to get an inhaler, I kept that inhaler. And even when it was expired, sometimes that, you know, whether it was for me or for my daughter, because my oldest daughter did end up getting an inhaler, even though it, you know, they only last a year. But even after they were expired, if something happened and we needed the inhaler, we unfortunately had to use the expired inhaler, because in order to get a new prescription for an inhaler, you have to go to the doctor and then you have to pay that expense. And sometimes it's just, you have to go through so much and it causes so many extra expenses just to get an inhaler that you need versus just, you know, having it. So like I said, unfortunately, I have used an out-of-date inhaler before.
Jalise, Mr. Lindsay, and Constance, we have to thank you. Those are such powerful stories, and it grips your heart. But at this point, we're going to open up for the group discussion around a few of the key issues that have been mentioned during the listening tour. And some of these questions I will direct to specific people in the group, but all of us will have different insights into some of these issues because we all have been patients at times. So please feel free to share your experiences. And Dr. Studdard, let's go to you. You have helped put together so much of this listening tour and listening to the patients. I know that this touches your heart and you deal with it on a day-to-day basis.
No, I appreciate it. I tell you, two things continue to hit my heart when we have been putting together this listening tour over the last several months and weeks. The two big issues that come out, and one that we've heard a lot about today, is access, whether it's access to appropriate physicians or access to safe, affordable, and effective medications. And neither one of those should be a problem in what we consider the greatest country in the world. It's just wrong. And then the other powerful thing that I don't think we've heard so much from Jalise and from Constance and her dad, because they have great relationship with Justin and with Damon, Dr. Haynes and Dr. Turner, is the issue of trust. And when we began to have our conversations of a small organizing group, my friend Bobby Morgan, who now works with Atmos, is a great young guy who I've gotten to be really good friends with over the last year, and I'm really appreciate that opportunity. We began to talk about the trust issue, and Bobby told me, he said, Dr. Studdard, you don't understand that African Americans frequently have the same concern about white coats as they do blue uniforms. And, you know, that just, as an old white doctor who's been practicing in Jackson for 40 years, you know, that just blew me back, and it bothers me and it hurts. And we have to do something to address the trust issue and all of these access issues. And so hearing these powerful stories, it's a great place for a lot of my friends who are on this phone call to be able to hear, because I don't know that they've ever heard this.
Thank you, Dr. Studdard. That brings me to this question. Is there something that you've heard today that you were unprepared to hear about? And this is for anyone in the group. Please feel free to speak up at this point. Mayor Lumumba, I know that you deal with so many issues. You knew I was going to call on you, didn't you, Mayor? I just talked with the mayor yesterday, and you hear from your constituents so often. Were you surprised by anything that you heard here today?
Well, first and foremost, you know how you get the sense that you're going to be called on in class. I just knew that I was going to be the name that you picked on, Maggie, so it rang true. You know, I don't know if surprise is the word, as I continue to be appalled by the fact that we aren't meeting people's needs. I thank Shalise, and I hope I'm saying your name correctly. And I thank the Lindsay family for being brave enough to share their stories. And I think that we have to hear this and understand that this is a shared problem. One thing that I believe is that, you know, if voting rights was the battle of the 20th century, then the right and access to health care is the battle of the 21st century. And I think that COVID-19 has not only shown a light and exposed underlying health conditions, it has exposed the underlying conditions of our nation. And you know, there are very few differences, so there's very little difference between a country that lacks the medical advancement to provide the services that people need, and a nation that has all that it needs in order to do so. But you know, we don't find it profitable. We don't work within community to deal with the trust issue that Dr. Studdard spoke of. And so I think that we have to see this as a shared endeavor and have to have a collective resolve to deal with it. As the city, we actually have made this one of our strategic aims of our strategic goals as a city, and that is to have healthy citizens. We believe that the growth vitality of our city is dependent upon it, and we can't truly talk about the city that we are aiming to be if we don't focus on that. To that aim, you know, I'm so grateful for so many of my friends that are on this call. I mean, I can really point to so many people that have helped us in so many ways as we form, you know, our response to COVID, as we form our response to the underlying health conditions and disparities within our community. And we're even trying to model the behavior that we want to see throughout our city. This hasn't been announced widely, but as we have just passed our budget, and for a city, our budget is a moral document that reflects what our values are as a city. And so we're happy that in our latest budget, we have just decided to cover 100% of the insurance premiums of all of our city employees. Not only because we recognize that as, you know, one of the greater savings within their pockets, but we also recognize the conditions of our community, and COVID-19 has truly demanded of us that we rise to the occasion. And so we hope that you know, what we have learned in this listening tour spreads throughout, and people truly understand what people are suffering from in our community and abroad.
Thank you so much, Mayor Lumumba. Anyone else want to respond to this before we move on to the next question? Okay, let's move to the next question. This question is for patients as well as clinicians. But remember, we all have been patients at times. Please feel free to share your experiences. Have you ever had to make a sacrifice or a trade-off, or know someone who has? And we talked about this a little bit earlier, in order to have the resources that you needed, such as medication or equipment, and what did you have to sacrifice?
I'll jump in there again, Maggie, hopefully to encourage some other responses. But I don't think that it's necessarily a foreign discussion amongst us where people, you know, have had to make those decisions where the right or the ability to have health care is a luxury. Ultimately, people aren't fighting for access to capital. They're fighting for access to live in every single way. And that's a common story. You know, I am fortunate, I'm blessed that you know, I have privilege that some people don't have at this point in my life. But I can even think about, you know, certain healthcare needs that my wife has had over time that we had to make, you know, in early decisions and compromises. And so I encourage people to share that, because this listening tour helps inform the you know, the decision making that we will take from here on out.
I am really grateful to be here. I think there's some amazing people gathered here, and the capacity of the folks on this screen to create some really meaningful changes is something that I think we can all be proud of. But I'll tell you that the compromise or lost human potential and capacity of our fellow citizens. I mean, Miss Shalise and Miss Constance and her dad, it's heartbreaking. And I think we must all recognize that that is a collective sacrifice. I mean, it's a collective loss if we don't call it a sacrifice. And the emotional toll of this on the families that are connected, on coworkers, the kind of corrosive impact of the toxic stress that kids have to deal with when they're in families where people are struggling with health issues. Like, those are all real things, and they manifest themselves in ways that, unfortunately, many of our community leaders have to come up with patchwork solutions to. So I just want to point out, I think no time is better than now to point out that this is a collection of systemic failures, and we will have to collectively address it that way. So my great hope for what we do here is to create a model of engagement, of planning for action that can be adapted across the different challenges that we face. So just thank you to those families who shared their stories. I know that's not always easy, but I'm inspired by what you've done, and I'm inspired in advance for the leadership that I know people on the screen are going to show.
Jane, you were next.
Well, I was just going to say, to kind of build on what Vaughn was sharing, is that, you know, we talk a lot about the tangible sacrifices that people are having to make to say, I can either buy my inhaler or I can go see my doctor. But when you look at the toll on family members who are trying to be the caregivers, and then who takes care of their families when they're trying to be the caregivers to their relatives, and this idea of toxic stress and systemic problems. I mean, my husband actually suffered from ARDS earlier this spring that we still don't know if it was caused by COVID or not. And, you know, we're privileged, we're educated, we're insured. Even we had issues. And I think to myself, having just recently walked through this entire journey, if this was a stressful situation for our family, and having 12-year-old twin girls who weren't really sure if dad was going to live or die, and what that would mean for our family if that happened. And you think about it, as a parent, you're trying to take care of the person who's sick, but you're also trying to take care of the children who are not. But there's a mental health component to this as well, that you have folks who are living with chronic illness, and we don't have a lot of great supports for people, support groups and folks to talk to. You know, I think that Vaughn is right. Whatever we do here is one facet of the issue, but because it's so systemic, we have to think about solutions that can be rolled out into these different areas to say there's a material need and it's right then, but then there's going to be a longer term need to take care of the caretakers and their families and to offer that kind of support. But yeah, I think that there's, from what we see from a funding perspective, so many of these issues just pile one on top of the other. And so you're never just trying to fundraise or fund to solve one problem. You're really solving a lot of different problems. Some of it's environmental, some of it's, you know, lifestyle, and then you get to chronic problems and then the systemic problems. And so I think we have to try to develop an approach that will look at all of those realities.
Did anyone else want to add anything to what we've heard so far?
I was gonna say, Penny Ainsworth, I see the flip side of it from the adult perspective. Day by day for the last 25 years of my life, I have the children who are coming into our facilities who have to carry the weight of their parents, who they see suffer through a lot of this. And what I mean by suffering is the health issues, which rolls down in the family to the food issues, which rolls down in the family to the electricity issues. And so it's one problem on top of another. I think while we're discussing this, it's imperative to make sure that we have a lane where we're discussing what to do for kids who are carrying around the stresses of adults. Honestly, they haven't been to real war, but they're suffering from post-traumatic stress syndromes. Our kids are so resilient because they continue to go on. They go to school, they do the best that they can. My last 7 years in Mississippi, I've seen some of the most profound and awesome kids in the world who should just fall apart. And I don't even know, even from my own history, if I would have been able to carry the load that our young people carries every single day in facing what their parents are dealing with. And now here's COVID. And then we have systemic racism. And then it's just so much going on. Yet no, I don't see enough movement around what do we need to do for kids, because they're becoming our future. And if we start working with them and ensuring that they understand the importance of healthy lifestyles, and that's one of our pillars at the Boys and Girls Clubs, exposing them to foods that are not from food deserts, that causes a lot of the diseases that our parents are suffering through. How do we make sure that they're being educated and understanding that the decisions that they make today, whether it be food, health, community, how can we help them make sure that tomorrow will be more promising for them, because they're carrying such heavy loads. So I wanted to keep the youth component on the table when we're having these discussions, because a lot of our kids are walking around carrying that load, and it's very heavy. And then I want to say, I applaud, and I'm in awe of the patients that spoke out. You guys are phenomenal. And caregivers, man, you're gladiators, you're superheroes. And to the doctors, thank you for all that you're doing. We need you, we appreciate you, and I'm grateful for everything that everyone is doing.
Thank you so much. As Penny mentioned, she's with the Boys and Girls Clubs of Central Mississippi. And of course, Jane Alexander is with the Community Foundation of Mississippi, and Vaughn Gordon is with the Winter Institute. We're about to move on. Constance, did any of the patients want to add anything to this before we move on to the next question? Was that you, Senator Horn?
Yeah, Maggie, I was going to put my 2 cents worth in here. And I have a very good Senate district. It has some of the best people in the state of Mississippi. A lot of very well-off people, a lot of middle-class people, and a lot of poor people. And I think about, as I go to visit folks in Northeast Jackson, or I go visit folks in Southern Madison County, I see a dynamic that does not exist when I go to Presidential Hills, or if I go out to Bolton, or if I go out to Edwards. You see, it's a tale of 2 worlds where people have the luxury of healthcare that is available to them and that they can easily access. And then there's this other element of folks who struggle, and they have to make those day-to-day decisions. Is it food? Is it medicine? Is it keeping the lights on? Is it keeping the rent paid or the mortgage paid? I'm constantly confronted with that, and as a policymaker, I'm embarrassed by our legislature. I'm embarrassed by our governor, who have the ability, have the means, but don't have the heart to bring about a systemic change as it relates to getting the ability to receive quality health care to every Mississippian as possible. The fact that we don't expand Medicaid, it's money that the federal government will pay for the first 3 years. It was 100% covered. Now the most we would ever have to pay is 10% of the coverage, and we can cover 300,000 additional Mississippians who are the working poor. So what we are doing with them is those 300,000 citizens are being consigned to poverty. because this opportunity for healthcare is not being available to them, and they often have to go out of pocket. They got to go to the emergency room to get care. They don't have a primary care physician that they can depend on. And it's really a failure of leadership, in my opinion, in the state of Mississippi, that we've not done this. And we're not doing it for political reasons. It's not economic reasons. It's not because the state can't afford it. We're doing it for political reasons. And the fact that we are making this political decision that is impacting so many of our citizens is unconscionable to me. And so I wanted to just put that 2 cents worth in with it. I just got in a few minutes ago from taking my dad to the doctor. And it was a 4-hour ordeal, and he's 86 years old, a little cantankerous, a little irascible, but a great guy all around. And I'm thinking how lucky I am and how lucky he is, how lucky I am to have him, how lucky he is to have a child who is able to take off and take him to the doctor, who's able to get him the kind of help that he needs. And it shouldn't be that somebody's fortunate to have that. It should be automatic, that no matter who you are, you're able to get these services and get the kind of care that reinforces your humanity. You know, we're dehumanizing a lot of people by the way we treat them, in terms of not only other areas of the country, but particularly how we deal with healthcare. It is the new civil right, and we cannot, even though we've got our leadership that says, well, we're not going to do with Obamacare because you can't count on it, blah, 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 blah. It's the best thing we've got out there. And so many people depend on it, and we could be making it available to the poorest citizens in the poorest state in the United States, and we don't do it.
Thank you so much, Senator Warren. Yes, go ahead, please.
Maggie, I'll throw in Senator Horn happens to be one of my patients, and I'm glad to hear that his father's cantankerous, and that, as Mississippians frequently say, the acorn doesn't fall far from the tree.
I'll tell a story. I'll tell a story quickly, Maggie. About 12 years ago, I was having this shortness of breath. And I'm just thinking that, oh man, I got to get back in the gym. You know, this is not working. And I just happened to be in a meeting with Dr. Bill Truly, who's mayor of Canton, but he's also a medical doctor. And I kept complaining. I said, man, I got a little shortness of breath, but you know, he said, look, you need to go to the hospital right now. And I didn't listen to him, but later that night, the pains got worse, and I wound up going to the hospital, found out I was having a pulmonary embolism as a result of blood clots, which run in my family, which I had not, you know, paid a lot. My mother had blood clots. I have a kid brother who's got blood clots. I've got a sister who had blood clots. And yeah, I said, oh, it's not going to happen to me. And so I wound up, and John Studdard just happened to be the doctor who treated me. And he's been treating me ever since. And it's a night and day difference. And so behavior has something to do with it. Not listening to what your body is telling you, you know, has a lot to do with it. But then being able to get somebody who's able to help turn your health around is a marvelous thing. And it should be an entitlement of every Mississippian.
Thank you both so much. Robert Langford is with Operation Shoestring. You deal with so many of our children in the inner city area. We've been talking about issues of trust and access, as well as equity when it comes to healthcare. You're on the front lines with some of those children in the inner city area. Would you say that you're seeing those issues with them already, the issue of trust? needing that access as well as equity.
Yeah, and I think Penny communicated a lot of things that we're seeing at Operation Shoestring that she's seeing with the Boys and Girls Clubs. One of the things that we've seen really since March is just a deepening of the disparities, the health disparities for our families, as we know that sort of the outcomes for the and low-income communities of color are so much worse than they are for white, more affluent communities, and sort of the impact on families. We have been reaching out to our families almost on a weekly basis, providing lots of support as we've been in this virtual space. We actually polled all of our families that we serve for our after school and summer programs, which for those of you who don't know, Operation Shoestring, an organization that I work for, that's sort of most of what we do. And the overwhelming majority of the parents that we serve, even before the school district at the end of July made a decision to go all virtual, told us they were planning to keep their kids at home, chiefly because of their current concerns about the impact of COVID-19 on them. And that's in direct response, I think, from concerns about access to affordable, responsive healthcare. So, it's disheartening, but it's the same old, same old. It's just deepening a really awful situation. And one of the things I was thinking about is I listened to a couple of previous people commenting earlier about this, and none of this is surprising to anybody on the call. Was my family, before I arrived, my father moved here in 1955, that fateful month in August when Emmett Till was so brutally murdered, and he came to be on the original faculty of UMC, only one M then, as it opened as a four-year school here. And he came because of the opportunity to be a faculty member, and he came chiefly because of the terrible health conditions of so many of Mississippi's residents, and chiefly African Americans. He was a hypertension guy. And as I've thought about this, and as we sort of kind of lived through this awful mire of COVID-19 since the middle of March, as I've listened to my own staff and to the parents that we serve kind of detail their own experiences about or fears about getting decent health care, whether or not they have good insurance, I've realized that sort of the conditions are, they're a little bit different, but they're just as sort of dehumanizing and Byzantine, right? The way that you have to pay for and try to access. And I don't lay that at the feet of the healthcare institutions. I think it is back to what Vaughn Gordon and to Senator Horn and a few others have talked about. It's systemically a problem in Mississippi that affects chiefly communities of color, though not exclusively, right? We're also hurting a lot of white folks, particularly low to moderate income white folks as well. And it is for political reasons, I would say. And I think this is, to Senator Horn's point, this is an opportunity to lead and to really do a 180 that will benefit everybody. Governor Bryant, I like to say that Governor Bryant stole Operation Shoestring's tagline at his first inauguration. I think it was "Rising Together." We've had "We All Rise Together" as our tagline at Operation Shoestring for about 15 years. And I really believe that, right? So we as a state will never thrive and realize our full potential if we are not looking after those most adversely affected by the awful systemic challenges of racism and the associated perils of poor health care and struggling education system. So that's not all that you asked for, Maggie, but it's all bound up in there together. And I think that the strategy is, the old strategy versus culture. We have to figure out how to lead and to have courage among, I think, a group of core leaders, both at the grassroots and grass tops levels, to change the culture in our state around this. The flag is potentially changing. It hasn't changed yet, right? Because of some external forces related to economics, as well as some moral pressures, and those all kind of allied to get folks to do some things that I thought were really courageous. We're not finished yet, though. And I think we'll have to have something like that. You know, what are the self-interest levers that facilitate change, that benefit the kids and families that Penny and I serve, and all of your families and the patients on here as well. So those are the things to figure out.
Robert, thanks. I think Rudy had something he wanted to add real quick, and then I'll come back to you, Jane. Go ahead, Rudy.
Yeah, and it might bring together some of the comments and lead again around that access point. From what I've heard, and I'm hoping I'm stringing this together most accurately, it's really we're having the conversation, and I'm really happy we are, about removing the false choice narrative, right? There's this false choice that's always presented to us, and we always wonder why. Hey, I don't understand why that patient just didn't buy that medicine. I don't understand why they just didn't keep their kids at home if they were that worried of COVID-19 in schools. Like, that's the choice that's always presented to them, not the choice of, I have childcare issues and I need to get a job or keep my job related issues. And so I think that's some of the same things that we're talking about when we talk about healthcare, and especially around chronic lung disease, which is, you know, these trade-offs that are presented to us when you don't have the choices that we assume someone does have. We fail to recognize the pain that causes on us, right? When we say, oh yes, your choice is to buy food or to buy an asthma medication, right? Why is that okay as the trade-off, right? Why is that the choice that we are giving our folks? And so I'm obviously really happy to hear that when we're talking about lung health, we're talking about it as a human rights issue, right? Something that should not be a choice that someone has to make of, do I have better lung health? Do I keep a job? Do I find a job? How do I help my children, right, make a healthy choice when those options might not actually be presented to them, right? Which is the whole point of an access issue. If you don't have the right opportunity accessible to you, it doesn't matter how great the opportunity is in front of us.
Jane, you wanted to respond?
Yeah, I did. I was going to kind of build on something that Robert was talking about. My parents, too, moved here in 1955. And my dad was a hospital administrator for 40 years. And I remember the first time he ever described what he called the rob Peter to pay Paul disproportionate share thing that the hospitals had worked out to say, we'll try to pay for our indigent care and figure out some way to make this, as Robert described, Byzantine system work. And I think that one of the things we have to think about as we're thinking through some strategies is, while most of us sitting here on this call are here because we have empathy for this and we recognize the human pain, but then exactly what you were just saying about kind of the economic cost that's involved in all of this. I think that one of the only ways that we can address this systemically is to recognize that there are a lot of people who are just going to use that old, why do you have to make this choice? You could just go get extra money somewhere or pull yourself up by your bootstraps, which I think we all get very tired of hearing, like that's a thing. So, but I do think that trying to equate this to the lost opportunity for all of us that Vaughn was talking about, you know, it's all these people who can't fulfill a promise and therefore, you know, can't finish an education, can't get a job, all of those things. I believe that we must build into what we're looking at as a system the lost opportunity we all have, and therefore we're not going to reach economic gains either, as long as we've got a drag on the healthcare system, which we all know can be a great economic driver if it's done right. Thank you, John Horn, for talking about that. Also, two other quick points. I used to work for a communications agency that did work with the heart study and with the CHIP health insurance program when we were trying to get people to enroll. And one of the things we found was that the very language that we use to talk about healthcare issues can be a barrier in and of itself. because I think that doctors are taught to communicate, and I'll just pick on John Studdard, or not communicate in a certain way that is very clinical and very dry. And sometimes, unless you've been doing this for a long time, or you just have a great deal of innate empathy, we forget that the language can be very intimidating and can scare people away from even asking questions. And as somebody who I was a chronic patient for a long time, so you have to be your own advocate. But it's like, how do you even advocate for yourself and your family to say, I'm sorry, but that's just not going to be an option for us, if you are already intimidated a little bit by both the white coat and the clinical setting and the language we use to try to communicate with our own patients and their families. So I think that's just the only other thing I would say.
Jane, thank you so much. Let's bring Shalise in here. Shalise, you have mentioned the stigma and what you have to deal with in bringing your child to a doctor, which is another aspect of this. Whether you have insurance or not, if you're perceived as not having it or being poor, there's a stigma there that you also have to deal with as a patient.
Yes, ma'am. I've witnessed it a couple of times with my children. You know, I'm a single mother. Like I said, I am a teacher, so I have state insurance, but thankfully my children qualify for the CHIPS program. A lot of quality doctors do not accept CHIPS insurance. I'm always able to find one good doctor. And if anybody is familiar with the CHIPS program, ever so often they change the insurance company. Like it might go from United Healthcare, which is widely accepted, to Molina, that is not so widely accepted. And so when they change, you know, they let you know, but you don't really know the difference in the way your children will be treated until you have to take them to the doctor. And when they see that the child is on CHIPS, they look at CHIPS as being Medicaid, you know, and they treat those, they really don't care in an essence. And it's sad to say that they really get treated poorly sometimes. And if a parent doesn't really understand or know how the type of treatment their child is supposed to receive, then they can be misdiagnosed. I've had to deal with my oldest child being misdiagnosed, that led to other problems, that led to her having to go to see different specialists because of a misdiagnosis, because the doctor just brushed them off like, oh, okay, we'll just say this and send you on. But because I know so many things from sufferings with asthma and different things, I can almost like, well, wait a minute, that's not right. And I will switch doctors. I've switched doctors so many times for my children, trying to find a quality doctor, or a doctor that even cares. And then every time I find one, I found an awesome doctor when my baby was a baby. She's 10 now. But unfortunately, he didn't stay but 6 months because Mississippi, from what I could gather from him, just didn't pay. And so he got a better offer in another state and he left. So I've switched from pediatrician to pediatrician to pediatrician over the years. And now I finally found one that I really love and I really trust, that no longer accepts their insurance. And so I often have to pay out of my pocket because I still want them to see that quality doctor, you know. And it's hard, but they sometimes look at children that have CHIPS, or individuals that have Medicaid or have CHIPS programs, and they just kind of treat them dismissively. You know, you don't always get quality care. You know, it's hard to find a quality doctor that actually cares. And then it's hard to put your trust into some, because once you do that, they either leave, or, you know, it's hard to find one that you can truly, truly trust.
Let's bring Dr. Chapman in very quickly, and then we're going to hear from Dr. Haynes. Believe it or not, this has been so wonderful, but we're running out of time. So Dr. Chapman, I know that you've dealt a lot with when it comes to access, when it comes to equity, and you're seeing those patients on a daily basis.
Yes, thank you, Maggie. Today, when I walked through the clinics, we was bringing in chairs because our clinic is overloaded with patients. COVID-19 has scared a lot of patients from seeing us. And so we are seeing patients now that are much, much sicker than when we last saw them. I had a 37-year-old that we hadn't seen since March, and she came back with an amputated leg. Diabetes is so out of control. I am so concerned about making sure that the patients have access to quality care, and that we have to do something about the health disparity in the state of Mississippi. More of our patients, as you know, with COVID-19, if you're hypertensive or diabetic or overweight, then you tend to have worse results. And I'm seeing that most of my patients fit in those categories. So I'm so thankful that I was invited to listen. And I appreciate everything that I heard.
Thank you so much. Dr. Haynes, you can go ahead and round things out for us. I hope everyone has learned. Dr. Studdard, when you talked about the trust issue and patients seeing the white coats, I literally had to kind of touch my chest. There are so many issues dealing with what is going on, not just in Mississippi, but throughout the nation. And we want to thank all of you so much for again, and we're praying for good lung health for everyone. It's so important. Dr. Haynes, take it away.
Thank you so much, Maggie. This has been such an awesome discussion, and we know we need to wrap up in the next 15 minutes to be respectful of everyone's time. But I want to ask a question for Shalise and Mr. Lindsay and Constance. If there's time, others can contribute, but you know, we did this for many reasons, but I want to ask you one specific question. If we could have come in today and said, or when you saw me in clinic or saw your doctor in clinic, and given you one piece of advice or recommended some guidance, just one thing that could have made your journey easier, what do you think that would be?
Well, starting with us, Dr. Haynes, what I want to say, I know Ms. Jane mentioned, to make it easier would be like when we first started to see Dr. Haynes, which it was tremendous. I seen the concern in Dr. Haynes, and he showed me as well as my father the concern. At first, shy to say, you know, anything about my father's health, but I seen Dr. Haynes were more concerned about his health. So that made me open up to Dr. Haynes about how my father's health was going. So each doctor's appointment that we made, I showed my concern to Dr. Haynes. Was my father's improving, or was my father declining? And when I took that information back to Dr. Haynes, because of when we came to the follow-up visits, he showed concern. So as him being a doctor showed concern to us, that's where my trust issue began. And we do thank Dr. Haynes for, you know, his showing his concern, and that's how it brought us closer to, you know, to dealing with our provider.
Anything else, Dr. Haynes? Is that you, Shalise?
Yes, ma'am.
Okay, go ahead.
I was just going to say, one resource that I would really, really love and would greatly appreciate would be a list of doctors that will take, you know, no matter what type of insurance you have, you know, for whether it's for an adult or for children. You know, both of my daughters as well as myself, we both suffer from asthma and allergies pretty bad. So to provide a resource of quality doctors, you know, that care, in my opinion, quality doctors that focus on that. You know, like I said, I had wonderful doctors. Dr. Hendricks was one of my doctors when I was a child, and Dr. Carlisle was an awesome doctor when I was young, and I trusted them both with my life, and my mom did as well. And I want the same type of care for my children, doctors that I can trust with my children's life as well as my own. And since now I'm starting to have asthma problems again since I had COVID, you know, it does cause a lingering effect. So just a resource guide of doctors that, you know, would be there and willing and wanting to help me and my children.
Excellent point, Candace. Dr. Haynes, that was going to bring us to the point that we ask everyone, and if you would do it very briefly, solutions. If you could just give us one solution and very quickly to how we can make a difference, especially when it comes to lung health, what would that be? And jump in at.
I would say expand Medicaid.
Okay, next. Expand Medicaid, we have that. Also, Shalise mentioned having a resource guide for patients that includes doctors who are willing to work with patients. That's a great solution. Anything else?
I would say awareness.
Social determinants of health.
I couldn't hear, was that Victoria? Go ahead, Victoria.
Yes, we need to pay attention to social determinants of health. As clinicians, we don't take enough time to talk about that. So if we say we need you to take this medicine, we need to say, do you have enough money to buy it? I think Dr. Haynes thought that I was just jumping in my chair over here. This is one of the things I'm very, very passionate about. And we have to be able to look at these multi-generational families where we have grandparents and great-grandparents taking care of children with asthma who might not know how to use an asthma pump. So all of these different issues, when the great-grandparent has to buy their own medicine, they're having to feed 5 grandchildren in the home. We have to do something. We have to.
We got to be aware of all the resources that's there so that when the doctors, the patients are sitting in front of you, if they're bothering on, well, I can't afford this, I can't afford that. Well, have you partnered with the Boys and Girls Clubs? Have you partnered with Operation Shoestrings? Do you know a list of resources that can help you outside of the medical world that could help in the medical world? I think that's key, just awareness of all that's at the table for all of our parents, because we take our kids from a whole child model. It's the whole household that helps us make sure that the kid is going to grow up and be healthy and happy and a taxpaying citizen. But we can't do that if the household is crumbling every day after the kid goes back home, you know. And so we can just really work together and have some type of resource or committee or community outreach committee where people who need awareness and need the resources can reach out to us and know that we're there. I think just awareness and knowledge is key.
Thank you so much. Pastor Rhodes, we haven't heard from you. Do you have one thing that you would add as a solution, as one of the solutions?
Sure. Well, thanks for the ability to be on today. I would say sharing those stories and really in our medical and insurance world, helping to value all people equally. And I think what I've heard today is it's not just the access part, is when you actually get to the doctors, when you actually get insurance, when you know, even have conversations like this, sometimes certain people are not valued as much. And so that's got to be changed. You know, another issue for me in talking about insurance, I think, quite frankly, we've got to figure out how to bust that up so that people can afford more insurance, not just Medicaid, but the fact that even if you have quote unquote good insurance, if you're middle class, even it could be very, very costly if you don't have, you know, employee granted insurance. So we've got to find a way to reduce insurance rates and costs and to make sure that we're equitable in the treatment of all patients.
Thank you. Anyone else? This is the last chance before we hear from Bobby Morgan, who is with Atmos. Last call.
Yes, Ms. Wade, quite a few people know me, so they won't be surprised that I will say this. But we have been culturally, socially, educationally prepared to accept a hierarchy of humanity and this belief that other people don't deserve the same level of dignity that we do everywhere they go, whether that is the hospital or school or to the grocery store or you know, stopped by the police. We have to undo that. So I want to make a specific challenge to our medical professionals and educators as it relates to this conversation. Make sure that your professional associations and the schools in our state who educate our healthcare providers are intentionally building a cultural competence that allows them to see the humanity in the people they serve. That impacts our systems. You won't go to a community where our doctors are not the most respected people there. Next to our bankers, shout out to Sam Lane. So I think that is one of the intentional things we have to do that create some lasting impact. Thank you.
Thank you. Let's go to Bobby Morgan. Thank you so much. He's going to wrap us up this afternoon.
Absolutely. Thank you, Maggie. And want to really express my appreciation to all of you this afternoon. It's been just a wonderful conversation. I'll tell you, I've learned a great deal over the past few weeks and months during the planning stages for this. I really just want to say a few words about why I think this issue is important to me and to Atmos Energy personally and professionally. You know, personally, and Dr. Haynes said it best, I'm a third generation Mississippian, and Jackson is home. And Mayor, thank you for the leadership of our city. Senator Horn, thank you for your leadership in the state Senate. And I'm a third generation Mississippian, but I was born in this state, and I grew up on military installations all around the world due to my father's occupation in the Air Force. And, you know, all the blessings in my life, professionally and personally, really stem from my parents, who are both Mississippians as well. And my father, as I said, was in the Air Force for 30 years. He was from the metropolis known as Fayette, Mississippi, right down the road from Natchez. And my father joined the Air Force in 1972. And for a Black man born in 1951 and for a Black man born in 1986, such as myself, it's two worlds apart. But one of the things that almost stopped my father from joining the Air Force and having those unbelievable experiences of marrying my mother, seeing the world, becoming a homeowner, participating in the full economic life of the country and the state, was the fear of submitting to the medical entrance exam. And you have to think back, for a Black man born in 1951, the predominant issue affecting men of that time, the African-American community, the health community at the time, were the Tuskegee experiments in the 1940s. And that drastically changed and impacted what Black mothers told their sons about doctors. And I want to say that it's been a point of pride for me to associate myself with Dr. Studdard and Dr. Haynes and Dr. Mansell, Dr. Turner. We have some wonderful clinicians here that really do care. And I really wanted to tell that story because there are some serious ramifications to not dealing with the trust issues. And I would just say professionally, working for Atmos Energy, we're the largest natural gas operating utility and operating in the state of Mississippi. We're only successful if the community is successful. And this is an issue that deeply impacts the community. And, you know, some of the statistics that I've heard that's just jaw-dropping over the past few weeks is that Mississippi has one of the highest death rates in the country for lung disease and asthma. And close to 14% of people in Jackson, Mississippi are living with chronic lung disease. And so this season of COVID, in the midst of a global pandemic, some of the social unrest gripping the country, corporations really have to do some self-examination about how we want to be a part of the conversation. And it's really a point of pride for me to be able to direct our philanthropic dollars to initiatives such as this. So proud to announce that Atmos Energy will be financially committing resources to the issues we discussed this afternoon. I hope we can do more in the months and years ahead, but I really want to say thank you to everyone here for your comments and for your stories. It's really been eye-opening. And I think for those of us in the private sector, we do have a responsibility to help you, and I look forward to doing that. And I know Rudy will provide a roadmap for what's ahead.
Really, I want to thank all of you. I got to admit, part of my emotion right now when we talked about tension was I actually go back to my grandfather, and Dr. Studdard knows a little bit. I'm not from Mississippi, but my grandfather grew up in Biloxi. So I heard a lot of stories, right? He grew up in 1929 in Biloxi. And so to know even the generational gap between us, but to still see some of the same issues alive today that just might present themselves differently. But I think what gets me so excited and probably emotional in a different way is the fact that we're all talking about how we can do it together, how we're hearing so many different perspectives and we're listening to them. And that's the exciting part about all of this. So I really wanted to thank you for taking the time to discuss this, knowing that although Jackson is our first stop, it is certainly not the last of what we plan to do. And so we will be following up with each of you individually, so you know, what you can do to support this work and how we can do this together, because there are lots of ways to contribute capital. Had a great conversation with Jane Alexander, who had taught me something, and really appreciate that. And so there's so much for us to do and to bridge the gaps and address many of these barriers that we've discussed today. So as we follow up, I also wanted to make that point that as that follow-up comes out, we are going to be collaborating and partnering with the Community Foundation in Mississippi, as well as Atmos Energy and a number of other organizations that are ready and willing to participate on how we can really make an impact locally and continue to bring this conversation up to a national level. And so really you have the commitment from CHEST and the CHEST Foundation to ensure we make this a reality. And so I do look forward to communicating and talking with you in the future. And so I really appreciate all your time today.
Rudy, thank you so much. Thanks to all of you, and give all of yourselves a big hand clap. You know, this is about the lung health of Mississippians. You're on the front lines. We thank you. Have a blessed day. And again, we are so thankful that you're willing to make a difference for so many people in the state of Mississippi. We're blessed to have all of you. Thank you again.